Hello, my name is Dr. Colin Birch. I'm very privileged to be the head of obstetrics and gynecology for the AHS in the Calgary Health Zone. I think women's health is so important. Women make up half the population, and a specialty that's devoted to women's care really needs to be highlighted at a greater level than it is currently. Now is really to speak out about the importance of their health and also to educate themselves about their health and use that opportunity not only to educate themselves but to educate those around them and speak out about how important it is. You know, the woman is a cornerstone of each family and so needs to be well, and the only way they're going to be that way is by keeping interested in their own health.
Hi, and welcome to Calgary Health Foundation's Women's Health Series. My name is Jody Hughes. I'm with Global Calgary, and I'm just so glad that you've joined me for this very important conversation around women's mental health. As Dr. Birch mentioned in the opening video, women make up more than 51% of the population, yet we just don't hear enough about women's health. And in fact, women's health research receives only 2% of the total research investments from the Canadian Institute of Health Research. As women, we often have a tendency to put our own health on the back burner to our family and to our loved ones until, of course, something happens. We are here tonight to hopefully change that. We do believe that education is empowerment. Calgary Health Foundation is a nonprofit that works with hospitals, community health programs, and long-term care in Calgary. With the support of donors, they invest in breakthrough initiatives and projects that are challenging and changing the status quo. We do have some of the very best researchers and clinicians in women's health right here in Calgary, and we'll get into those details of just who are going to be joining us in just a few minutes. But first, we do want to cover some housekeeping items before we start everything. There is a Q&A button at the bottom of the screen. This session is all about getting the information that you need. So please use that Q&A button. If you choose to use the chat, then your questions will be public. We're going to get through as many questions as possible, recorded, and we will make that available for everybody to share. It is a true privilege to first welcome Sandra Baker for our traditional land acknowledgement. Sandra?
Hello, my name is Sandra Baker, and I am an educator with the Indigenous Wellness Corps. My grandmothers were Mi'kmaq and Acadian. I am a proud Métis woman. I was asked today to deliver this land acknowledgement for you, and I'm very happy to do so. When the blood in your veins returns to the sea, and the earth in your bones returns to the ground, perhaps then you will remember that this land does not belong to you, but it is you who belong to this land. I would like to take this opportunity to acknowledge the land in which today's speakers are delivering from, and myself as well. This is the traditional territories of the people of Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy, comprising of the Siksika, the Pekainai and Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wellesley First Nations. The city of Calgary is also home to the Métis Nation Region 3. A land acknowledgement is a formal statement that recognizes and respects Indigenous peoples as traditional stewards of this land and the enduring relationships that exist between Indigenous peoples and their traditional territories. Thank you. Merci. Welalen.
Thank you, Sandra. We are incredibly lucky to have Dr. Lisa Gagnon join us tonight. She's the founder of the Women's Mental Health Clinic. She's also a psychiatrist. But before we talk to Dr. Gagnon, we are going to chat with Courtney, who has very bravely agreed to share her experience. I will let you know that Courtney's story is about mental psychosis, which is a critical and extreme condition that impacts 1 in 1,000 women. We are going to touch on a number of very hard things, including suicide. If that is at all a trigger for you, please do take a break if you need to do so. In addition to being a grateful patient, Courtney is a nurse practitioner working with women in postpartum mental health, and she has bravely stepped forward to open up a dialogue, a very hard dialogue about being a mom. Courtney, thank you so much for making some time for us today.
My pleasure. Thanks for having me.
Tell us a little bit about who you are, how would you have described yourself before you had kids?
Sure. I born and raised here in Calgary, and basically met my husband in grade 11, and we got married after being together for 18 years, and we've been together for 27 years now. And Yeah, basically, you marry your high school sweetheart, and both my husband and I have big careers. My husband's a pilot, and I did my bachelor's degree in nursing, and worked as a registered nurse for several years. And then I went back to school and did my master's, postmaster's nurse practitioner diploma. And essentially, sort of my intention around that was a real passion that I had for mental health, really sort of recognizing that there's issues with the delivery of patient care in lots of different areas. In particular, though, I found mental health, and that, I wanted to make it my life's work to break down barriers, improve delivery of care in all sorts of groups, in particular the vulnerable. And so, big kind of, I guess, professional life, and very rewarding career. And then lots of, friends and great family. And my husband and I decided that we would have kids. We were excited and sort of ready for that step in our lives. So,
And as you know, every once in a while, life will sort of throw you a curveball. I think probably little did you know at that time, as you were planning to have kids, your intent to focus on mental health and to protect the vulnerable, it really came full circle in that suddenly you found yourself as being that person who needed that care and who needed somebody there to help you navigate a system that, even from the inside was a bit challenging. Tell us about what happened with your first.
Yeah, for sure. So, a lot of people, I think they ask, like, Courtney, did you have any prior mental health issues? And I didn't. I pretty healthy, fortunately, and my pregnancy was great. No issues in pregnancy, and that's rare. I think all of us as women that have been on the journey of having children have a story, and the story might be the challenges of trying to get pregnant, what happened when they were pregnant, and then in my case, it was what happened after. And so basically, I had an unfortunately long labor, as many women do. And when my daughter was born, she was unresponsive. So it was a very traumatic sort of experience as a healthcare provider, watching your daughter being resuscitated by a code team. Very scary. And, fortunately, she didn't have any long-term consequences, and they were able to save her life. But it was a rough start for sure. And, a lot of the focus was, when I started sort of struggling initially, was, oh, this must be related to this traumatic, stressful labor that Courtney went through. But that actually, I think didn't help. But, we've learned that essentially, even if I had a great labor, I would have still gotten as sick as I did. And so basically what happened was, I was in the hospital with a newborn baby, and I started hallucinating. So started seeing things that weren't actually there, and they were very distressing to me. At one point, I looked down at my daughter, and her face basically started turning black, and she was dying in my arms. And so I pulled the emergency call bell and, yelled for help. And, everyone rushed in, and she was fine. It was this real or was it not? And I didn't know if it was real or not at the time. And then there was, a lot of other unusual behavior. I just was not myself. I could not sleep. Even hospital, I tried to sleep and I just laid there and like blank minded sort of and totally exhausted, but could not get to sleep. And then my anxiety really started getting out of control. You can imagine a long labor and several nights without sleep. People don't do well. And I was just totally out of character. I called my dad, and my husband was away at the time, right after the baby was born. And, said, something's not right. You've got to come to the hospital. And he came, and, my poor dad is almost 80 and tried to advocate for me and knew that I wasn't well. And, I was terrified that they were going to take my daughter away from me because of how I was behaving. It was sort of like, she's so upset. She's so anxious. She's not coping. And then basically I ended up getting discharged home and, started the journey that ended up being 6 months of a very severe perinatal mood disorder. It was weeks and weeks of terrible insomnia, where I could not sleep at all. My daughter was wonderful. She slept well, was such a settled child, and I was still able to, lovingly look after her, fortunately. But, you do that for so long and without any sleep. And, an underlying mental health disorder that hadn't been diagnosed, and things get pretty rough. So I was confused. I love to cook, and I couldn't follow recipes, for example. I'd go to do the laundry, and just like trivial things like that just got me really lost, and it was like I was in a delirium kind of state, like sort of like kind of a zombie, if that makes sense. And I remember one day was particularly terrifying, where I had been looking after my daughter and on my own, and it was early stages, kind of maybe a month in, and I completely lost track of time, and you hear people say, oh yeah, you have a baby and you lose track of time because they take up all your time, like looking after them. But this was different. It was like a case of I didn't know what I had done. Had I fed her? Had I changed her? And the whole day had passed, and I just remember absolute terror, like what had happened. And at the time, I called my mother-in-law and said, "You've got to come over. Something is just not right." And so, she did. And, really from that point on was when we started the journey of trying to get help, like really aggressively. And,
I have to, sorry, Courtney, I've heard it described before for situations where your brain just isn't working the way that you want it to, and you're facing a trauma, or you're, dealing with a crisis, that I've heard it described that it's almost like somebody has taken everything, if it were in a filing cabinet, they've taken everything, and they've dumped the filing cabinet upside down. Mm-hmm. And then someone else came along and they picked up all the files and they tried to be helpful, and they put, how to brush your teeth in the folder that belongs to how to do laundry. And they put, understanding time into the folder that is like, this is how you drive a car. And so when you go to access these things, you can't find it, but it's so frightening because you don't know why you can't find it. You don't know where it is. You're sure it's in there. And then how do you even describe that feeling of feeling so lost to somebody without feeling like, there's something that, maybe you're afraid. Can you recover from this? What's going to happen next?
Mm-hmm. Yeah, that's a good way of describing it. It's an alternative kind of, or, how they describe it is like, you're just not in touch with your reality. And what of being yourself. And, it was like almost that my body was a shell, and, what I knew of Courtney and what I knew of, even, my mental capacities and my cognitive skills, it was like they were gone. And it was very terrifying. And I knew that something very serious was wrong. I looked for a long time, to find that diagnosis. And, there was various diagnoses that, weren't wrong along the way. The ones you expect to hear, like postpartum anxiety and postpartum depression, of course. And, I think there was an element of that. But it was, the 11th doctor that I saw, who, she's a real angel in our eyes, of course, and such a well-respected psychiatrist. She assessed me, and within 20 minutes, she knew what was wrong. And my husband and my dad were there, and she pulled. I think it was my husband and my dad into the appointment, and I, was maybe waiting outside, and told them what was wrong. And of course, I was terrified, but I'm sure, my family must have just, been in, it explained everything. And, she said, Courtney's been living in this postpartum psychosis for 6 months. Like, this is why it's been so bad. And, it was literally from her office, I was admitted to the Foothills Hospital and under her care for a month. And, it was a tough place to be. You're not with your baby, and, there's that dynamic, but I did get better, and that's what it's all about. So.
We talked a little bit before we started about some of the trepidation you feel about, you want to advocate and you want to tell your story, but then it's also very stressful because you fear that there's a bit of a stigma still, and you're in the industry. I mean, so I think that I think it's important that you recognize how important it is that you do tell your story, because you are representative of so many women who are going about their journey, and the last thing they're expecting to have happen is this. And I think it's because of people like you who share your story that you will, I guarantee, make a difference in the life of so many women, and you'll never even realize the impact that sharing your story has. So thank you for doing that. I think it's very important you know that, and I can appreciate the trepidation. We don't ever like to, talk about things like that.
Mm-hmm. Yeah, I mean, you think that, yeah, for sure it is, and when I do things like this, or, I do a lot of speaking about perinatal mental health, and it brings up a lot of emotion, and of course the emotion is there around how traumatic it was, and living with, that I was that sick and kind of missed that time in my daughter's life, and that, I was suicidal, and that when those emotions come up, though, and I prepare myself to talk like I am today, a big part of where, my tears come around it is the shame. It's a terrible thing to carry around. My daughter will be 6 in August, and I still carry an immense amount of shame about what happened. And as someone that has dedicated their life to mental health disorders and understanding all kinds of mental health disorders, not just perinatal mental illness, is that knowing that, it's not anyone's fault. The brain is no different than other parts of the body that, can become sick. And that, if I, as a medical professional that know that care for patients with mental health disorders, have so much shame that I carry, how is someone that's dealing with perinatal mental health that doesn't have the education and experience I have feeling? Like, I can imagine their shame is just so much deeper, and I feel for them, and it's really, really hard, and it's a real barrier for women and families to reach out for help. They don't want to admit that they're sick. They don't, they feel like it's a sign of weakness, and, that there's a flaw in their character. And, that breaks my heart for sure. And, I get it,
I think it's hard too, because as women, we have this tendency to we shoulder a lot of stuff, and we don't want to. I mean, men, it's the same, but I'm thinking of it from the perspective of motherhood. You know, we want to be able to do everything ourselves. We don't want to say that we're struggling. We don't want to admit that maybe part of it just isn't feeling the way that we had pictured, because, you know, you end up putting in so many factors of, you know, people who wanted to have kids and they couldn't, and, you know, and we add all of this unnecessary guilt to our plate. And I think that sometimes it's hard, because if you aren't able to properly advocate for yourself, even to your own circle, I think there's a tendency for people to say, like, oh, that's okay, dear, like, you know, everyone feels like that, or everybody, you know. But I think we know inside when something is wrong. And I think that, you know, it's very important for women in that moment when you are so vulnerable and yet trying to be so strong, to know when it is okay to listen to yourself and say, no, I know this isn't right. I know it's not okay.
It's very true, you know, and knowing that it's not just about mom, it's about baby, it's about the family dynamic. You know, we know that moms who go untreated with perinatal mood disorder, you know, it interferes with mom and baby bonding. It can interfere with milestones for children. You know, the newborn baby, but even older children, you know, that are being looked after by the mom that isn't doing well, they can have challenges themselves. And that, you know, like to your point, that moms might feel like, oh, if I'm advocating for me and I'm sick, you know, that's selfish in some way, and that I'm stronger than this, I should be able to get through this. But, you know, maybe if it's knowing that it's about you, of course, but that, you know, this can be a family issue. You know, we know it has huge societal impacts, economic impacts. If, you know, moms don't go are untreated, you know, that there's a lot of women, unfortunately, that die from this. And that, you know, really, yeah, like it's meant to be a joyful time, you know, and yeah, you know, there's no shame, you know, there's no lack of character or strength of character by, you know, getting help.
Being vulnerable is actually a great sign of strength. Courtney, thank you so much for your time today. I think you have, as I said before, no idea the difference you've likely made in so many people's lives. And I think it is important that you know how appreciated it is that you are sharing your story, and that you're willing to be vulnerable and share what was an awful moment, but also a great achievement for you as well, in that you did overcome it and now you're able to help so many people. So thank you so much for being with us.
My pleasure. You know, there's that saying, make your mess your message. And so that's kind of what my goal is here, you know.
I love that. That's so good.
Yeah. Yeah. And, you know, whatever I can do to help moms out there, you know, count me as part of your village, you know. So I'm happy to share. Thanks for having me.
Dr. Lisa Gagnon is a psychiatrist and the founder of the Women's Mental Health Clinic, and she was also instrumental in Courtney's care. Dr. Gagnon, thank you so much for being with us today.
Oh, thank you for having me.
Let's just start with that general overview of postpartum and mental health. Obviously, Courtney's situation was an extreme one, but how prevalent is postpartum depression or postpartum, some sort of a postpartum mental health situation in women?
Oh, it's very common, Jody. 1 in 5 women will struggle with their mental health. I'll include in pregnancy and postpartum, so it's incredibly common. And I think there's some myths around it.
What kinds of myths? We'll just get right into it.
We'll get right into it. Yeah. So I'll start off with, I think everybody's heard of postpartum depression, which has been studied quite a bit more, but anxiety conditions are actually very common, even more common than depression. And they can come in various forms. There can be obsessive compulsive disorder, panic disorder, generalized anxiety, or even PTSD as a result of previous life events or delivery. So there's really a wide range of conditions that can occur through pregnancy and postpartum. And I think our culture, we don't talk about it. I don't think we share information very readily about that. This can be a really difficult time. And there's a perception that if you talk about your mental health, you're not a good parent, or that you're not a good mother. And that's absolutely not the case.
Do you think that that's the main reason why we don't talk about it, or is it something that are we even recognizing that there's an issue, or what do you think is holding us back from having these really honest conversations?
That's an excellent question. I think it's probably a mix of our culture and maybe our TV shows and movies, perceiving this as a very joyous and happy time, and that people are very fearful around talking about it because feeling that they could be judged. There's a lot of pressure, I think, on women, and being a good enough parent, and that actually doesn't look the same for everyone. What is a great parent, and I think there's a lot of concern around judgment and so forth.
I also wonder if, sometimes are people even aware, because this is for a first time mother especially, you're navigating a situation you have literally never been in before. And so of course you would see people around you and you'd have that influence of TV shows or your friends or your moms and your stepmothers all telling you how it should be. But this is really one of the few moments in life where we are 100% in uncharted territory. So are we even equipped to know when something isn't right?
Yeah, that's an excellent question, Jody. I think given that we're not openly discussing it, we do risk, and we have seen that people don't come forward and get adequate care. And that normalizing the experience can be very, very stressful, positive stress. But it can be very stressful and change your life, and your hormones change several hundred times over. So I think starting the conversation and being brave and sharing what's going on really helps empower women for the first time going through this, having a better understanding. I'll also add, Jody, that I think I'm not sure this is exclusive to perinatal mental health. I think the conversations are coming around mental health generally. I do general adult psychiatry as well. And I think generally we have a tendency not to talk about emotions very readily, and we don't post that on social media. Like, people don't post their bad moments on social media.
No.
Yeah. And honestly, that is part of the problem. I sometimes have to tell my moms, don't go on social media. That is not your friend. Oh, not
Absolutely.
The person, but yeah.
Yeah, absolutely. And it's tricky because I think social media really enforces that that zero sum. Like, either, look, I'm having ice cream and it's the greatest moment of my life, but there's no yes ands. It's not like, sure, I'm having ice cream, the ice cream's really great, I had the worst day, and I don't know what's going to happen tomorrow and I'm terrified. Like, there aren't a lot of yes ands in those kinds of moments. And I think in motherhood too, it's hard because, like you said, we want this to be that picture perfect. I mean, whoever thinks they're going to have a baby and it's not going to be picture perfect, we don't plan for that. And I think it's very difficult probably for not just women, their partners, their families, siblings, everybody, to understand this is a yes and, like, yes, this is wonderful and joyous and amazing. And I'm really having a problem here. I think it's good that we're normalizing the yes and more, but it's hard because how do you advocate for yourself when you're not even sure?
Absolutely. Absolutely. So I think one of the things that we wanted to highlight today was times when you would want to get some help. So maybe I'll just take a minute and talk about that, Jody, that if somebody is feeling like they're really struggling to sleep, or they're feeling down on themselves, or feeling guilty about how they're managing, they're really struggling with their mood, or anxiety, that would be something that certainly you could present to your family doctor. Most family doctors can manage, I would say, mild and moderate anxiety and depression. But if somebody's, I would encourage everybody out there, if you're having suicidal thoughts, if you're having, and women do. Women have suicidal thoughts through pregnancy. And if you do have thoughts of harming your child, or you have thoughts that you're hearing things or seeing things, or beliefs that are out of keeping with reality, which I get happens quite often. Like sometimes people tell me that they feel like their baby is a special, beyond kind of normal, special, like a religious figure, or that their baby is not theirs, it was switched. Like there's a lot of beliefs that can happen outside of keeping with reality, and those are urgent situations. So if somebody is considering hurting themselves, hurting their children, or they're out of touch with reality or hearing things, they should present to the emergency department, or consider calling the distress line, which is open 24 hours a day.
What happens if you
So
make that phone call? Because I think there'd be a great fear from moms that I'm going to do that and then everything's going to be taken away from me.
absolutely, that's thank you for bringing that up, Jody. That's one of the common myths, and that is another barrier for people to talk. All the time I hear moms say, I really hesitate to talk about this because I worry that children's services will get involved, or people will think I'm not a fit mother. And that's not the case. If children's services are involved, they really do want you to be addressing your mental health. They want you to be getting better. They want you to be with your children, is my experience. I can't speak for every experience, but so no, actually, it's quite the opposite. Accessing help is viewed as very good if you're struggling with your mental health. And Jody, you were asking what the process is. So if you presented to the emergency department, or called the distress line and talked about your feelings and talked about your experiences, really that is viewed as a good sign and engaging in support. If children's services do get called, which is quite rare, it's really rare. I think I'm only a handful of patients a year for me, and we see 600 a year at the clinic. That only a handful that we need children's services to be involved. And of those handful, most of them, the vast majority, are able to continue parenting and accessing help, and children's services provide extra resources.
Is there any way to know if you're going to be somebody who is likely to experience any sort of an issue with postpartum anxiety or postpartum depression? We heard from Courtney, and she was telling her story, and she was healthy. She had this fabulous support network and is even in the medical field, and it completely took her by surprise. And I have heard that story before of women who really didn't ever think it was going to be them. They didn't think they had any sort of a, a likely indicator that this might be in their journey. So is it common that you would know ahead of time that you might run into this?
It is. Having trouble previously with mental health, or a family history of mental health, are a couple risk factors for mental health difficulties in pregnancy and postpartum. The number one risk factor for postpartum depression or anxiety is how you're doing in pregnancy. So we want to try to get on top of things quite early in the condition, and so that things go better postpartum. But absolutely, especially quite severe cases, seems for some women it comes out of the blue, which is actually really tough, I think, for women and their families. And it also slows the recognition down sometimes. Is really how bad could it be is kind of the perception sometimes people say when the mom, previously really high functioning, doing well, is doing really terribly, especially postpartum. So I think if we're seeing a really big change and the mom, even though historically has been quite high functioning and fairly stable, is still access help, still consider getting that support and take what they're saying seriously. I think that is a big danger, is that we assume it's not going to happen to our loved ones or to us.
And then, as we were talking about before, this sort of goes full circle, it feels like, in that, because it's a new experience, how do you know when something is a normal reaction, a normal, postpartum, or something that's unusual or that's extreme or that is signaling that you do need help? How do you know the difference? I mean, you mentioned not sleeping, but I don't know very many moms that sleep really well after a baby. I know most moms are a little bit anxious. What is too anxious? Like, how do you gauge that? It's so subjective, it feels like.
Oh, yeah, that's an excellent point, Jody. And I should preface not sleeping when the baby's sleeping.
Okay.
So I often see moms they're exhausted, but they can't turn their brain off. They can't sleep when the baby's sleeping. They might be checking the baby repeatedly, quite worried about catastrophizing, worried about bad outcomes. They're struggling to enjoy things. They're struggling with low mood, or they might be having a lot of difficulty eating or doing the basic care for themselves and for the baby. Sometimes they are able to do what they need to do for the baby, but they really struggle with their own care and doing anything and not really interested in doing a lot. So that would be a picture more of depression, or they're having trouble. They're just on edge all the time, having bad memories coming up of a traumatic event, or just anxious and not able to feel relaxed, and that often causes difficulty with sleeping. And as I mentioned earlier, hearing things or seeing things, or having some beliefs out of keeping with reality. So that would be what Courtney was experiencing, was the postpartum psychosis. And that picture is where people are having some beliefs out of keeping with reality, or they might be hearing things. And that's a more severe extreme form, and that's an emergency. And if somebody is seriously thinking of hurting themselves, that also is emergency. Jody, I just also want to mention that thoughts of hurting your children is also something that is very common, and it's another myth that we wanted to break, is that there was a researcher, Amy Wenzel, who's from the UK, who studied this, and most parents have some thoughts of hurting their children at some point, but it can become an anxiety condition where they have trouble with, moving on with their day, and they get really fixated on it. Whereas most people, you have a thought of hurting your children, and you don't act on it, and you might go, that's a weird thought, and then move on. Whereas with obsessive compulsive disorder, which is more common in pregnancy and postpartum, people do kind of get stuck there, and they really ruminate, and what does that mean? And their reaction would be horrified or quite anxious about it, and they are very reluctant to talk about that experience because they're very worried about the children's services or people thinking they're a bad parent. And of course, if they're considering acting on, or have acted on, or acted in frustration and hurt their children, we really do need to look at that and make sure they still act the support they need to help them in those situations. But I also want to just put out there that thoughts of harming your children are quite common, and I think talking about it is really important so that we understand what's going on for that mom and provide the right level of support.
What kind of support do you offer? I mean, you have the women's health clinic. What happens if somebody comes to you? How do they get help? What can they expect? Or is every journey so individual that it would be really hard to sort of sum it up?
Yeah, Jody, so we see the more moderate to severe end of the spectrum of mental health conditions in pregnancy and postpartum. And family doctors and midwives and obstetricians, we partner with them all the time, and they often are able to manage the more mild to moderate through pregnancy and postpartum. When somebody has more of a moderate to severe and they're referred to us, so we do an intake assessment and we offer a mix of medications if that's required. Therapy is often a part of the treatment, and normalizing it and hopefully engaging the partner or their loved ones in supporting them through this journey.
I would have to think that it's a very alienating moment because, you know, you've spent all of this time with this little human growing inside of you, and, you know, you deliver, you understand that, you know, you're a mom and this is exciting and this is like a lifelong commitment. You have your partner, your support system, but then all of a sudden all of this stuff is going on and it's only you, and it doesn't feel very good. I would have to think it's very alienating for moms who are finding themselves, even from mild but sometimes to those, I mean, obviously to the more critical cases, it must be very lonely.
Oh, I think definitely those women really struggle, and our patients really struggle with the loneliness and feeling alienated. And that's why this conversation and being brave and talking to your supports, your doctor, whoever your supports look like, is so important, because I think normalizing some of it and helping people go through the journey and help them get better is part of breaking the alienation. It's about coming together and really supporting that mom and the new baby to move forward.
Dr. Gagnon, how do you know what signs would be normal? I mean, I think most women will find themselves after having a baby with moments where they're definitely, I mean, a lot has happened. You know, you're probably crying at some points, you're probably stressed, you're probably feeling anxious. Um, are all of those signs, you know, under that umbrella of normal, or do they fall under, no, you do need help because you just spent half an afternoon crying?
Yeah. That's an excellent question, Jody. Most women do have something called postpartum blues, and that's in the neighborhood of 80, even maybe 90% of women. And that's shortly after delivery, within a couple days. And it's related probably to the hormones changing so quickly and it feeling overwhelmed, tearful. But if that mood or anxiety is persistent beyond a few days and they're feeling excessive guilt or suicidal thoughts, that's where we'd be more concerned. But of course, that is part of the normal course of things within a few days after delivery.
And so let's say you find yourself needing some help and you end up in front of a practitioner that doesn't know you necessarily. You know, how can you best advocate for yourself if you are talking to the distress center or an ER doctor, or, you know, even your family doctor? How can you best express that you know something isn't right? I mean, it's so subjective to walk in and say, I'm just not sleeping well, or I don't feel right, or like you've already said that, you know, some women or most women will think it would harm their baby. So how do you compare this to this isn't normal? Would it be helpful to say, I know who I was, this is who I was, to put it into context to somebody, even your own family doctor, to put it into context? Or how can you best advocate for yourself?
Well, I think, Jody, what would be really important is to be really honest with whoever's in front of you. They're there to help you, and they're there to support you through the journey, not to judge you, and they can help you best if they have a full understanding of what's going on for you. And because we only make decisions based on what we see in front of us. So what is going on? And thank you for coming and joining the webinar, because I hope this empowers you to be honest with what you're feeling. And some of it might not feel very good and might feel shameful, but pushing through that and being brave, I think, gets you the right kind of help when you need it.
So what happens if we don't get help? I mean, is this something that will just go away? Will there be any long-term impacts on us, on our relationships? Is there data to support that? Or does this have an impact on our children if we don't seek help in these moments? Is there a real push that we really should be paying attention to this?
Yeah, that's another excellent question, Jody. There is lots of data to show that maternal mental health can have some long-term impacts on childhood development. So even her mental health through the pregnancy can impact fetal development and through early childhood as well. And in fact, ACEs, which is a very famous study from the CDC and Kaiser Permanente, showed that actually maternal mental health is one of several adverse childhood experiences that together, if a child has a number of them, has a whole host of outcomes for their development, including physical health as an adult, mental health, addictions. It's actually kind of mind-blowing how many effects there can be from early childhood development. So I would really encourage people to seek help, because it's actually good for the whole family. It's important for the child's development as well as the mom's suffering. So, and that impacts everyone, even the partner, and the partner's mental health can be impacted too.
Wonderful. Well, I know people have a lot of questions, so we do appreciate your time today, Dr. Gagnon. Thank you so much for all that you're doing. I know there are many women who are grateful for your service and for your insight and your knowledge and your patience. So thank you for everything that you're doing.
Thank you.
And we will turn it over to Val, who's going to handle some questions. Val?
Thanks, Jody. I just wanted to thank Ramina, who's been helping us out on the chat. She's answering some questions and sharing some resources that we will be sharing after the webinar. Dr. Gagnon is a wealth of information, so we want to get those resources to you. There is a lot of questions, and thank you so much for joining us, Dr. Gagnon. And I know we kind of got to chat a little bit since we did the interview, but with Courtney and her story, lots of questions are coming in about what happens if you have a second baby. And I know that Courtney did have a second child, and I'm just wondering, if you can talk a little bit about if the risk increases for women who might have had any postpartum depression or psychosis, when they have their first baby, if it's increased risk in their second, and maybe how they can decrease some of the fear about having a second child or going into their second birth.
Thank you, Val. That's a great question. It is a risk factor if you've had a previous mental health condition through pregnancy and postpartum. And for postpartum psychosis, the risk is about 50% for you to have another episode. For other mental health conditions, the risk isn't quite as high, but my clinical experience, which my colleagues in the clinic would share with me, is that if we treat it and if we are on top of it and managing it, we can actually reduce the risk quite a bit. So our experience in the clinic is that the second, and some of my patients third, fourth, I think fourth is the most, pregnancies and postpartum have gone substantially different than the first.
So is there any, if anybody's in their, say, second pregnancy, they've had some previous concerns around baby blues or all the way to postpartum depression, maybe psychosis, while they're pregnant, is there anything they should be doing or help they should be seeking in order to prepare them for giving birth?
That's a good question, Val, and I think it depends on the severity. If they managed fairly well, and if they were worked if they were seeing primarily a family physician, and they managed well with medications and some therapy support, getting on that through the pregnancy would be very helpful, because as I mentioned in the webinar, that's the biggest risk factor for difficulties postpartum, is that actually they're struggling through the pregnancy and it continues on. I think reducing stress and trying to take good care of yourself, which is hard sometimes with a little one at home, but if you're able to take some time to keep your stress levels lower, and then being aware and have a low threshold for getting on top of your mental health if things are starting to turn towards being like it had been the first time. So within the clinic, we do have a number of women who choose, or we do a risk-benefit conversation around medications, and they elect to stay on the medications, or we put them back on the medications when they start having some symptoms, sometimes in pregnancy or shortly after postpartum, and really having a family or support network in place to help you work through that, so that everybody's working together to make sure that you're getting rest and support and taking care of the kids too.
Yeah, I think that's really important. And I think you mentioned it too, is, starting a dialogue and being honest with your family members as well about how you're feeling is just so much more important too, if you potentially are at higher risk. So I'm glad for everybody that's coming today and asking these questions. There's also some questions about if you do opt to take some medication. Of course, we're worried about what happens to baby, whether we're pregnant or we're breastfeeding. So if you do choose to take medication, like, what is the impact for baby and the benefit for mom? Can you talk a little bit about that?
Absolutely, Val. It depends partly on the medication. If we're talking mostly of the antidepressants, most of them are relatively safe, and the major malformations are the first trimester, so that's the first 12, 13 weeks of pregnancy, and the baseline population risk of malformations is 3 to 5%, and the antidepressants don't increase it above 3 to 5%. Long-term neurodevelopmental outcomes, we don't know everything, but most of the studies are quite reassuring, and that these kids are doing well compared to an untreated mother who's struggling with her mood or anxiety. At the time of delivery, some of the antidepressants have a neonatal withdrawal or adaptation. That's still actually not the majority of neonates. So most neonates will not have that, but it goes away. It's not life-threatening. And then in terms of, there is a rare risk called persistent pulmonary hypertension of the newborn, which is it is rare, and it's controversial whether the antidepressants, the SSRI, the selective serotonin reuptake inhibitor, are the ones that are primarily associated with it, and it's controversial whether the medications actually cause that. I would refer people to the Mother to Baby website. That's an excellent site from the States that talks about individual medication and the safety in pregnancy and lactation. Because medication safety is a really big topic, hard to summarize because there's a lot of medications, but I think talking to your care provider and looking at that site would be helpful. And one thing people tend to forget is that, unfortunately, if you have a mental health condition, and especially if you're struggling with it, we don't have a zero risk situation. So if your mental health isn't very good through pregnancy, we're weighing your mental health condition and the impact on you and the baby and your family against medication safety. Of course, we'd prefer if you didn't have a condition, but people are not seeing me without any conditions. So usually it's weighing those factors out, and it's an individual conversation with your care provider.
Yeah, that's great. There's lots of questions on the medications, and I'm just maybe just the conversation too with moms who are feeling a lot of guilt about, maybe needing to go the option of medication with a little bit of uncertainty. Do you have any advice for them in terms of managing the anxiety that they might have or the guilt that they might have about needing to try various medications to find the right fit for them, even while they're pregnant or while they're breastfeeding? How do you navigate that with moms?
Yeah, that's a fair question, Val. And unfortunately, I think mothers feel a lot of guilt about a lot of things. And I, I think it's good we're talking about this because hopefully we can try to tackle some of that guilt. The first thing I'd say is that if this was, say, diabetes or hypertension, we wouldn't be having this conversation. I don't think people would feel really guilty if they were needing it for a physical ailment. And I think that's sometimes related to the stigma. Because it's mental health, we think that we should be stronger, that we're weak. And I talk to women all the time that if this was a blood pressure issue, or you say were in a car accident and broke your leg, you certainly would not be handle yourself this way and feel really guilty about things in the same manner. And so I would encourage people to maybe try to have that mindset is that just because it's a mental health condition doesn't mean it is less than, and that it's not deserving of the same level of attention as a physical ailment would. I hope that
That's
would
great.
be one approach. Yeah.
Yeah, I think it's a tough conversation for sure, but I'm glad we're able to ask these questions because I think a lot of women kind of weigh them and don't know, when to speak up about them or who they can ask. So I think this is really important.
Val, I'm sorry, one other thought I was just having is sometimes people find it easier if what would you say to a friend who was saying that? Rather than thinking or having a lot of guilt, maybe if you had a friend who was going through this and considering medications, how would you treat your friend? I think sometimes people, especially with mental health troubles, are very harsh in their head towards themselves, and encouraging them to approach them their own thoughts the way they would approach a friend would be sometimes is helpful.
Yeah, that's great advice. It's just some other questions too about people who might have been treated or are currently being treated for anxiety and depression, and thinking about getting pregnant. Are they higher risk for postpartum depression and anxiety? Do they need to potentially look at medication adjustments? Is there anything that they can do kind of leading into preparation to be pregnant or having their baby that is a little bit different maybe than somebody that's not, currently facing anxiety or depression?
Mm-hmm. I would encourage them to talk with their caregiver and do that risk-benefit analysis and seeing if they're able to manage reducing their stress in preparation. I approach these decisions by looking at how the severity of how ill you've been in the past. So if somebody's been in the hospital needing mental health treatment in the hospital, that's certainly a more severe episode or condition at one point. So I would worry having them off. I have had patients who've been off the medications, who've, say, been in the hospital for a severe suicide attempt or really bad anxiety. But I do think it would be helpful to walk through that with your care provider and looking at your individual factors for whether you can consider coming off the medication or not, and maybe considering adding extra support from a psychotherapy point of view, reducing stress. Those are some factors that might be helpful.
Yeah, that's great. I wanted to ask, there was a question here too about just what happens when you reach a point where you do need to be admitted into the hospital. I think that's a very intimidating thing for a lot of people. And it's kind of unknown and it's got a lot of stigma around it. And so Courtney was brave enough to talk about her time in the hospital or needing to go to the hospital. Can you maybe just break down some of the myths or thinking around what might happen in the hospital? What is an experience for somebody in the hospital actually like?
Mm-hmm. So I do work on an adult inpatient unit, a general unit at the Foothills. And initially somebody would be assessed in the emergency department by an emergency physician, and then they would be seen by the mental health team, which usually includes a nurse as well as maybe a resident, but certainly a psychiatrist. And when they're admitted to the hospital, if they're really worried about the mom, or the mom might be a little bit unsure of whether she wants to come into the hospital, at times they do put forms to have them stay in the hospital for a while to get a better sense of what's going on. And what the forms are is that they are wanting you to stay because they're very worried about you, and they're wanting you to stay for an assessment. If somebody's going into the hospital voluntarily, though, and open to getting help, that doesn't need to happen. When they're admitted to the hospital, which hospital they go to in Calgary depends on where there's beds available. And it's understandable that that could be a very intimidating process, but everybody along the journey is there to help you and to help work with you to try to make this as a positive experience where you can move forward and get better. Right now, especially with COVID, it's more difficult for, we don't have visitors in the hospital, but in the past, we would really encourage that mom and baby are able to visit, and whoever their support person is able to visit, and even go on passes if things are going well. So they're still connecting with their loved ones and their baby. We do get a breast pump if somebody is breastfeeding, and we for sure talk about the safety of the medications if that's a consideration in breastfeeding, and if they're pregnant in pregnancy as well. So and then in the hospital, we have a variety of groups that are offered that people would be able to partake in, and would be meeting with their doctor every day, as well as talking with the nurses several times a day, talking about strategies to manage your mental health and coping strategies. So and it varies quite a bit how long people are there. I have some moms who are only in for a day or two, and I have had some who have been in for a couple months. I would say that's not usual, but it does depend on how they're doing and how things are going through their healing process.
That's great. I think that's it's important to kind of know, right? Because it helps break down that barrier of fear of I might need to be admitted, and that's a very scary kind of thought. I guess one more big question that kind of seems to be popping up a lot, of course, with COVID and the isolation that a lot of moms are feeling. I know there's some restrictions in terms of, trying to stay quarantined or isolated prior to giving birth and some of those things. Are you really seeing a lot of impact to women in terms of their disposition towards the baby blues or postpartum depression, or even depression, anxiety during pregnancy? And is there any tips you might be able to offer people in terms of tools that they can work through in this time of the world we live in, I guess, to just help them through this?
Yeah. It's interesting, Val, because I think COVID's impacted everybody, and it's been a tough year in some for everybody. I've had a few, it's not many, but some have found that it hasn't impacted their postpartum very much. they're at home with the infant, and it hasn't been a big change. Actually, some of them are quite introverted and are quite pleased to have reasons to be at home with the baby. But those who are struggling more are ones that maybe their families aren't in town, might not even be in the country. They're not getting the support they need around childcare. Although some of the COVID, I would encourage people to look at the restrictions, because there are some childcare exemptions in the COVID restrictions. But I do feel like people are more isolated, and they're anxious. What is their delivery going to look like with the COVID rules, and who can be their support person in the hospital? So I would encourage, I guess, a couple things generally with COVID is maybe limit your time on getting news and TV and using reputable sources. I think too much news can be really hard on our mental health. Trying to keep a routine would be really helpful, and trying to connect with people. I know it's difficult via Zoom or other platforms virtually, but still connecting with people, I think, would be really helpful. Families Matter is an excellent resource around pregnancy, and actually they have supports often for dads too. And I think it's keep connecting and taking care of yourself, and having some time for yourself would be helpful too, because I think that's the other hard part is there's not a lot of breaks from being at home for a lot of the moms. So creating some breaks, whether that going for a walk or trying to have a Zoom friend get together would be helpful.
Yeah, that's great. I love the connected community too. And there's some questions here about resources for, dads or significant others, or any of your support network too. It sounds like Family Matters is a really great resource for that. And I know that your clinic is a specialty clinic for moderate to severe cases, and you do some family work, I guess, with support structures. But is there any resources for people that might be seeking help through their general practitioner, for their family network, to better understand what they might be going through or to better support them?
Mm-hmm. So if we're talking about perinatal, we're talking perinatal still, not generally, Val?
Yeah, I think perinatal and postpartum.
And postpartum, yeah. So if it's reading more about the conditions, Family Matters does have some information, but Postpartum Support International is a good website to get some more information about mental health conditions through pregnancy and postpartum. There's actually if you look up perinatal mental health or reproductive mental health, there's actually quite a few organizations that has options to connect online, and as well as literature you can read about. In terms of locally in Calgary here, we do have a number of sister programs. Perinatal mental health is actually a sister program we work with quite often that does therapy for pregnant and postpartum. And as I mentioned, Families Matters is another one. Families Matter has a rural peer support. We've been talking mostly about the Calgary proper city, but Families Matter has a peer support program rurally, which is quite helpful as well. And your family doctor might also have therapy or a behavioral specialist that you're able to see.
That's great. Well, thanks for your time, Lisa. I know so many people on the chat are just so incredibly thankful for you and for the clinic. And I just wanted to say, if people want to support women's mental health, and of course the Women's Mental Health Clinic, we are part of the Shoppers Run for Women, which happens in July. You can go to the Calgary Health Foundation website for information on that and to sign up. But it's such a great event. And even when it's done virtually, to just lift women up, spread some awareness about some of these challenges that women face, open the dialogue with your friends, family, network, and enjoy each other's company. So if you're interested, please sign up for the Shoppers Drug Mart Run for Women, which supports the Women's Mental Health Clinic. And we also have a webinar coming up next Tuesday. If you are pregnant, you have a lot of questions about the vaccination, we have 2 doctors coming in to talk about the questions that you have and address the questions from the audience. So feel free to join that. Information will be available as well. So thanks for joining us, Lisa. It's always such a great pleasure to chat. And I just find you a wealth of knowledge, and I think everybody else did too. So thank you so much. We're going to share some resources, and over to you, Mary.
My name is Mary Story, and I'm a development officer at Calgary Health Foundation. We hope you enjoyed this great discussion. As a foundation, we are committed to changing the status quo and making an impact in areas that matter to you. There are lots of ways you can stay involved, including showing your support by making a donation to support healthcare at calgaryhealthfoundation.ca or reaching out to any member of the Calgary Health Foundation team. Thank you.